This is Dr. Christopher Carrubba, one of the medical directors at TrueLearn, and I'm back again for another one of our Step 1 question breakdowns. Today, we're going to be looking at a question from Renal, showing you how you can work through laboratory findings and work through patient history to come to the correct answer. Now, as always, I like starting off with the last sentence first, just to get a feel for where the question's going to be going, what the answer choices are. While I just told you the question is renal. Remember, on test day, you'll never know where it's coming from until you really get that chance to look. I also think that just by seeing the answer choices, you're able to be a little bit more of an active participant as you read through the question. You can think about, what does a question about AIN typically look like? What are the details that might be there if this is FSGS? And I think when you're doing that, you're able to read each sentence and think a little bit more about where this could be going. So now that we've looked at this, we've seen our possibilities, we can dive right in and, be that active test taker. So we see it's a 65-year-old with peripheral edema and weight gain coming in. Right away, that starts to help me because we can think down to, what does my typical question about AIN look like? And it's not that. My AIN question is usually someone who is, recently given a medication, usually an antibiotic, and they're coming in with rash, acute kidney injury, maybe CVA tenderness, eosinophilia on lab. So just right off the bat, we kind of can see that it's not our typical AIN picture. Even looking down at good pasture syndrome, we can kind of tell right off the bat, that's not our typical good pasture question. That's something that's usually focusing more on hematuria, hemoptysis in there with that. So just by looking at the answers and reading that first sentence, we've already been able to pretty reliably cut this down to just 3 possibilities. So we see that the patient's symptoms have, worsened since they began 10 weeks ago. And then they're giving me this history of colorectal cancer that was recently diagnosed, and he's currently receiving chemotherapy. When a question stem puts in something like that, malignancy diagnosis, history of radiation, chemotherapy, I definitely always want to take a second and think about if it could be related to any of the possible answer choices. And while it certainly is, I'll see if you guys can think about that, and we'll come back to that in a minute. Looking through here, he has hyperlipidemia, doesn't really relate to any of this. No tobacco, alcohol, or illicit drugs. Vitals look pretty good. And all we're seeing on exam is some generalized edema. And we know that labs are showing an elevated creatinine. So where do we go from there? So right away, urinalysis shows 4+ proteinuria. And that really, keeps B, C, and E open for us because those are the only answer choices that are going to be able to give me nephrotic disease. And as we go through here, none of this really, matters. And we see fatty casts, which again go with nephrotic disease here. And, one thing you're going to realize is that for these conditions, for anything that gets tested, there's always multiple ways that they could push you towards picking the correct answer. One question might opt to give you a biopsy. You could be either shown an image or told what the biopsy is, describing, and that might be what pushes you there. Another one could focus more on symptoms that might go with a particular one. This question here, the only way I can really tell the difference between these 3 things is going to be the patient risk factor that I'm looking at here. So if we're thinking about, what that could be, it's really going to tie into the colorectal cancer, aspect of that. And solid organ tumors are a risk factor for membranous nephropathy. And that's how I would be able to answer this question correctly. Now, the next thing that brings me to is, how do you study a question like this? And I think it's always going to be kind of tying into what you were being tested is how you're able to get the maximum benefit when you study. I think a rookie or a novice going through this is really just going to focus their studies on membranous nephropathy only. They're going to maybe look at the risk factors for that, the pathophys. They're going to look at the biopsy. But I think where you can really help yourself for the future and make sure you get questions right is really thinking about what were the learning objectives of this question? What did I have to do to get it right? And then trying to apply that to the other answer choices. So here I would stop and say, okay, to answer this question correctly, I needed to realize that it was a nephrotic disease, and then I needed to identify the specific nephrotic disease based on the risk factors that were there. And that's when I can really maximize the benefit and say, okay, for this question, amyloidosis could have been the correct answer if they changed the history and maybe switched it over to where this patient had a history of RA, because we know amyloidosis that affects the kidneys is usually coming from a chronic inflammatory condition like RA, or it could be coming from, multiple myeloma. Thinking about FSGS, what are the risk factors for FSGS? Well, if they change this to injection drug use, particularly heroin, if they said he had a history of HIV. From an epidemiologic standpoint, FSGS is more common in Black Americans and Hispanics. So that could have been something that would have changed. And then the other answers, we want to focus on maybe the difference in their presentations. We talked about how AIN is usually more of a drug reaction, but would only give me more mild proteinuria, could give me white blood cell casts. With good pasture syndrome, that's more of a nephritic disease. So we'll see hypertension, hematuria, red blood cell cast, worked in there. And I think the place to take it even another level is, not just limiting your, the thinking to, these answer choices, but saying, okay, what are the risk factors for my other nephrotic nephritic diseases, and really making sure that if you threw a similar question at me, but with different details, I'm going to be able to, anytime identify these conditions based on their risk factors. So as you study, just make sure you're prepared to identify things in, as many different ways as possible. And, that you're not always expecting to see just one narrow spectrum of how a disease could be tested. And I think when you start doing that, that's when you're really going to improve your score and, improve the chances that you, pass this exam and, then carry that over to, doing well with shelf exams and step 2. So thank you guys, and look forward to doing more of these with you in the future.